Welcome to Oncology Spotlight, a podcast where we interview those who are working on the war against cancer, brought to you by the OncoAssist team. First of all, thanks very much for joining us again. And tell us to start off, what's the key theme of ASCO 2023?
ASCO 2023 is partnering with patients, the cornerstone of cancer care and research. And we truly believe that our whole role, we're a professional society, we are the people who treat patients with cancer, but our whole role is to get the best outcomes for the patients, and we can't do that without the partnership with patients.
Of course, brilliant. And can you tell me about the work that ASCO is doing in health tech and AI?
Well, clearly we have to address it, and it's here in front of us. We've got to make data collection easier. We've got to make our electronic medical records actually talk to each other and be able to pull out the data that we were promised when we got into this in an easy way. We're trying to figure out, how do we use ChatGPT and other forms of AI? It's important. We need to use it. It can be a very valuable tool. But at this point, you can also get this information. And so we have to figure out how to make sure that we're getting the right information out and that we're validating things and we're using it to our advantage.
Excellent. And can you tell me how ASCO has changed over the years as a conference?
Well, we've gotten a lot bigger. This year, ASCO will, I think we're announcing, we'll have 44,000 registrants from this meeting. That is bigger than ever, bigger than before the pandemic. 7,000 abstracts submitted. That is also bigger than ever. The amount of science and the people here and the quality of it. And I look at, and this isn't ASCO specific, but what's happened to cancer between all the genomics and all the new targets that we're learning from the genomics, and then all the new drugs, the pace of drugs that are being approved, it's impossible to keep up with it. And I was a breast cancer specialist, and I could barely keep up in breast cancer, and to keep up with all the cancer types, all the new drugs, all the new assays that you have to do, it's incredible. So a big part of our job is to help distill that and educate and put it in an easily digestible way so that the community physician can go back to clinic tomorrow and know how to treat their patient and to give the best outcomes.
Excellent. Is there any study or paper or anything that you found particularly interesting over the last 2 years?
We've had a few themes of some of the most important abstracts. An important theme is really de-escalating therapy, especially in situations where we're getting excellent outcomes. And now we're worried about survivorship and the toxicity. So can we give less? So 2 important abstracts looking at in Hodgkin lymphoma, for example, can we back off and by using response to treatment, pick out who doesn't need radiation, especially to the mediastinum, which long-term survivors, if you get radiation at a young age, you get more heart disease, more lung disease, etc. And so using response to treatment and then looking at can we back off on the radiation is really important. We've had 2 trials looking at minimally invasive surgery versus the standard, more aggressive surgery, showing no difference in recurrences by using the less aggressive surgery and a lot of reduction in the long-term side effects. So de-escalation of treatment, optimization of therapy, knowing some people do need that radiation, but how do we pick them out? We've also had some confirmation of prior trials that we saw early outcomes, disease-free survival, and now we've got confirmation that they resulted in overall survival. So that's really important. A couple of antibody-drug conjugates. That's a great new area as of the last 5 or 6 years. Targeting the antibody, getting the drug inside an interesting new antibody-drug conjugate for ovarian cancer that targets the folate receptor alpha, getting the drug in. And then we saw the antibody-drug conjugate, the trastuzumab deruxtecan, for her too, and now looked at it across a variety of other solid tumors that had intermediate or high HER2 expression, and seeing that that works across a broad array of cancers, not just breast cancer where it was initially approved. So some interesting cellular therapies, CAR T cell now in refractory myeloma, for example. And then some trials looking at how getting better access to care really improves outcomes. So Medicaid expansion relevant to the United States, getting more access to treatment improves outcomes in GI cancers. An interesting partnership between a children's cancer center in San Diego, right on the Mexico border, and then Tijuana on the other side. So these two children's cancer hospitals that are separated by, I think it's 12 or 13 miles.
Yeah.
And they partnered to improve leukemia outcomes by just sharing best practices, helping build capacity. The Mexican government chipped in and said, oh, this is a great project. We'll give you the drugs you need. And the incredible improvement in survival from childhood leukemia through this great partnership across the border.
Excellent. That's brilliant. That's great. And final question, is ASCO planning to stay in Chicago for the long term, or has there been any plans?
There are very few cities that can house our meeting. And that is why we have long-term contracts in Chicago. I know we have a signed contract for the next 5 years. So we will be here for a while.
Yeah.
And it is going to be really hard to find another city with enough hotel rooms, especially when Taylor Swift comes into town and they take a bunch of hotel rooms. So we will be here for a while.
Yeah.
And Chicago is a great city, as they love hosting us, and it's fun, and it's got a good airport that lots of people could get to. So we'll be here for a while.
Brilliant. Brilliant. Yeah, it's a great city.
Yeah.
Brilliant. Thank you very much.
Okay.
Thank you.
Good.